Now, staying in this country, phase 2 of a massive medical strike has begun here in Korea after tens of thousands of doctors walked off the job on Monday. For the next week and a half or so, doctors taking part in the strike will cut their work hours and limit time spent with patients. Our Kwon So-ah reports.
The medical strike has just begun. After Monday's walkout, the Korean Medical Association is progressing to the next round of its strike as planned. While those taking part in Monday's strike refused to provide any medical services, starting Tuesday through March 23rd, doctors will turn to a work-to-rule action. This means they won't work more than 40 hours a week, which is around 10 hours fewer than usual, and will treat patients for no longer than 15 minutes. A full 6-day strike is then planned to begin on March 24th, which could also include the closing of emergency rooms and intensive care centers. If residents and interns participate in the 2-week strike too, there are concerns this will affect the public, considering they work up to 100 hours a week. Although some patients were inconvenienced by Monday's walkout, it didn't create as much chaos as initially feared. The government has reiterated it will react strongly to illegal actions that put the health of the public at risk. The Health Ministry estimates around 29% of doctors at hospitals and local clinics took part in Monday's walkout, while the Medical Association puts the figure at 49%. As big as that discrepancy are the stark differences in opinion over the government's health reform plans, which prompted the KMA strike. KMA doctors are against government plans to introduce a telemedicine system that would allow for patients in remote areas to be diagnosed and treated via webcam, smartphone, or even email, saying this will impair the quality of medical services. The KMA is also up in arms over the government's move to run for-profit subsidiaries. Some doctors are worried the reforms could eventually lead to privatization of the medical sector. The Medical Association says it expects even more doctors to take part in the second round of strikes. Kwon So-ah, Arirang News.